All right, we'll go ahead and start. So we said when the patient has renal failure, everyone is okay to remember, number one, anemia. Everyone is okay, kidneys are bad, what do you monitor? Anemia. What drug I said to give for anemia? Apogen. What is second thing I said to monitor for your patient? Potassium and hyperkalemia word. And what medication do we give? And we just finished that, the K-axylate you can give. You can give Lasix, and you already should know avoid potassium sparing, which are your aldactone and direnium. And third treatment, you can give them dextrose with the regular insulin. Next is, you remember, they have very low calcium, so they're going to be risk for fracture. What is high here is, remember, where do we get calcium? When we talk about parathyroid gland, I said whenever you have calcium level is low, your phosphorus is high. So when you want to increase here your calcium, what are we reducing here is the phosphorus. And what do we increase here? Vitamin D for absorption. So underline that word, high phosphorus, and second line, vitamin D, you will give them. Calcium supplement. And what do you prevent? These patients are osteoporosis, and write down the word fracture. The risk for fracture. Their bones are weaker. Next is the risk for infection. Their resistance is low. Next is metabolic acidosis. I said earlier when kidneys are failing, but remember, any acidosis are, underline the word, hydrogen ions are high. And you give them to treat when they're in metabolic acidosis. You can treat them by giving soda bicarb. So underline the word soda bicarb is the treatment for metabolic acidosis. Next is cramping is there. And why? Because uremia is high, and also write down the word calcium is low. Now uric acid is high. Whenever you have low calcium, you feel a lot of cramping. And that question can be also for your OB. Mothers have a lot of cramping. What do you increase here? Calcium, because of calcium. And also uric acid. Neurological problem. So renal failure, protein, you remember. And what is your monitoring your patient here? Neurological. And underline the word neuropathy. What is neuropathy comes here is when it's affecting too much of protein and too many things are high, it will start affecting is what is the neurological assessment. Everyone remember renal failure. What are you monitoring here? Neuropathy. And what are you monitoring here? Neurological assessment. Neuropathy is the nerve, and they have less sensation, less feeling. And neuropathy means is why. That's why they can feel in their circulation if they have any pressure for longer time. Next is eyes are affected, and they have burning sensation. Calcium deposit, lubricating, and safe environment. Very, very important. Next is, everyone remember, when your kidneys are bad, you have itching problem. And what is pruritus means is why, underline the word, waste product, but what? Second line, uremic frost. What is the word is uremic frost? Urea. A urate crystal they deposit on the skin, and their risk for a skin breakdown. Everyone remember the word whenever you see is uremia word or uremic syndrome, that means goes in the kidney, uric acid is high. Itching is a big problem for them, and they are depositing the uremic frost. Now remember, when there is a uremic frost word is there, that means the kidney on the skin, they are depositing the white crystal. And their skin looks more like a white flaking skin. So a lot of patients, they don't want to get out because they feel really bad because their skin is all over, is more with the white urate crystals are coming. So uremic frost, write down the word skin. Itching is there. How does their skin look? More is like they have flaking skin and a white color because the uremic syndrome is there. And breaking down of it can cause rashes and avoid soap. You can give antihistamine, antipruritic medication for itching. What is uremic syndrome? Is too much of urea, and what is urea and the other products are called nitrogen waste. So what is high here? Nitrogen waste are high. And it causes for patient kidneys are failing. Uremic syndrome means patient is level of consciousness, and uremic syndrome is sign of renal failure. And if everyone is okay, uremic syndrome word, uremic frost word, neuropathy word, and that all goes in your renal patient. Next page, you will go oliguria. The urine is very low, and also you are monitoring electrolytes. Another word they use, azotemia. What is azotemia? High nitrogen waste. So they use the different wording. Azotemia word, uremic syndrome word, and underline the word is that it can cause, when the nitrogen waste can lead to diarrhea or constipation. Intervention are monitor hypotension. Why do you monitor hypotension? Because they're going for dialysis and they're giving fluid to remove the diuretics. So when you give diuretics, is hypertension. First you are monitoring retaining fluid. And hypotension you add there when you monitor when you're giving diuretics and they are already increasing a lot of fluid. So you still monitor. So hypervolemia, hypertension, hypovolemia, hypotension. Then next is limit sodium and potassium and phosphate and assist patient to cope with the disease, and especially when they have uremic syndrome. Now remember, we use the word limit, but in a lot of questions would be give them moderate protein. So what is we are affecting? Protein, sodium, potassium, phosphate. Everyone is okay? Those are important for your patient is on when they're getting these medication. I will move on dialysis. There are two kinds of dialysis. We have hemodialysis. Hemodialysis is, first thing, why do we give dialysis? If there is a question, what are we removing? What is patient is retaining? Fluid. What is high here? Electrolytes. Are we clear? Why do you give your patient dialysis? Your question is, why do we give dialysis? Your answer is to remove protein metabolism, but highlight the word urea. Urea is high. Creatinine is high. Uric acid is high. And you are maintaining body fluid and electrolytes. Number one, fluids. Keep that in mind, they're retaining fluids. Electrolytes are high. And what did we said? BUN and creatinine. And what is BUN and creatinine? They're using the word nitrogen waste. So what are you doing? You're reducing fluid, you're reducing electrolytes, and what are you reducing? Nitrogen. See, the questions are, why do you send your patient for dialysis? Your answer is you're reducing what? Fluid overload. And second thing, you're reducing what? Electrolytes. What was high here? Potassium, phosphate, sodium. All that you got to remove from the body by giving what? Dialysis. So what are we giving patient here? Dialysis. What kind of dialysis? I'm going to talk about hemodialysis. Principle of hemodialysis is, number one, they put like a membrane, and we call the word semi-permeable membrane. So there is a membrane, and what does the membrane does? Allow small particle to pass, such as urea, creatinine, uric acid, and water molecule to pass through. So what is a membrane is called? Semi-permeable membrane, which allow is all the smallest particle to pass through. And what are we passing through in the blood is here your electrolytes we have, and you have all that urea which is high in uric acid. What is the principle of your dialysis for hemodialysis is called diffusion. What is the word diffusion is the particles are moving from higher concentration or greater concentration to lesser concentration. So what is diffusion is the particles, not the fluid, the particles are moving from higher to lower concentration. That is the word is called diffusion. Some wording we got to know because in your exam they have all the wording of your question. They can ask you the principle. So if you know the word semi-permeable membrane, you know the word diffusion. Are we clear? Those are the principle for dialysis. Now, the fluid they're using is called dialysis bath, and they are composed of water. What does they have the fluid? With water and major electrolytes. The fluid they're using, the dialysis need not to be a sterile. Not necessary that is a sterile. Why? Because bacteria and virus, they are big, large, and they large to pass through the membrane. So they're not passing through the membrane, bacteria and virus, because we're using that membrane, semi-permeable membrane. So it's not necessarily is a sterile. But what is important in the third line? Water is treated with safe water supply. The water must be with safe water supply. So the key answers are, is the fluid need to be sterile? No. But what is it important here? The water should be with safe supply, what they're using in the dialysis. And what is the principle of dialysis is, I said semi-permeable membrane and diffusion. Then fluid, what they're using is treated with a proper water supply. Next is, in hold the patient is when they're going on hemodialysis, especially your hypertension medication is underline that word, hypertension medication, antihypertensive, and water-soluble vitamin, antibiotic, digoxin. So hypertension, digoxin medication, antibiotic patient is taking, or any water-soluble your vitamins are, should not be given to the patient when they're going for dialysis. Another word is, when patient is going for dialysis, do not give them their medication. Are we clear? Why? Because dialysis, all the drugs would be going out from the body. They're washing out. So you give 9 o'clock the blood pressure medication, it hasn't been working, and by the time they go, they're wasting the drug. So when do you give them the medication? After the dialysis. Everyone is okay? Patient is going for hemodialysis. Do not give medication, especially your digoxin, your blood pressure medication, or even they didn't give, remember the word, hold the medication. When they come back, you give it to them. But very important is your blood pressure medication, your heart medication, your antibiotic, and water-soluble medications are all your water-soluble vitamin. So number one, medication, we said hold. Next line, vital sign, slightly temperature high is normal, because the fluid, when they're doing dialysis, is warm. So it said slight warming of blood from dialysis is okay. Second line, excessive temperature, means if they give you a question, patient has 103 temperature, that's sign of infection. 98.8, 99, 100, patient has maybe because patient came back. But if patient is running higher, temperature could be sign of infection. So remember, because the blood was warm, slight is okay. Then if you see there is a sign of infection, what do? Underline the word culture. And what do you do before your patient is going for dialysis? So I want you to understand, number one, your patient is going for dialysis. Now you're going to work after you're getting your license, and you'll have a lot of patients in nursing home or home, they're going on dialysis. So you must know, number one, is do not give them medication. We already said what are the drugs you do not give. Before dialysis, what is your responsibility? Number one, wait. For your patient, you must weigh them before they're going on dialysis. So underline the word is here, wait before dialysis. And after also, but if they ask you, what do you do before your patient is going for dialysis? Wait is important. After dialysis, I would say, remember, very important, the blood pressure. Because why? They lost a lot of fluid in dialysis. And what does it will, patient will feel after dialysis? Remember the word dizziness, because they lost a lot of fluid. And what do they have? Hypotension. Safety is important. As soon as your patient returns after dialysis, put them back to bed. So keep two things in mind. Before dialysis, weight is important. You can check electrolyte, but weight is very important. Afterwards, also, they check the weight to see how much they lost the weight. But vital sign, the blood pressure is important. Now, let me highlight, then I want to add few things. As weight we did, monitor for bleeding, nutrition. Very important, pre-op care. Before patient is going, is their diet. What do? You are a nurse and you are sending a patient for dialysis. And they'll give you, apply all that answers, what do you think you're going to do? Number one, you must have your communication between you and dialysis center. You're sending your patient to dialysis. So remember, is we said the weight, we said the diet. Meaning is, patient is gone from your place for 3 to 4 hours, wherever you're working, for dialysis. So what is your responsibility? Your transportation came to pick up your patient at 10 o'clock. Patient even didn't eat his breakfast, and patient is not coming back until 1 o'clock and 2 o'clock, or maybe later. So what is important? Dialysis, they don't give food. As a nurse, make sure they eat their meal before and send them extra snack, because they're not going to give food. And what happened? They lost a lot of fluid, they're already weak, and here they have no food. So remember, give them a packed or snack or lunch with your patient. So they're not starving. They have some drink, maybe whatever. And kitchen knows what kind of snack you can send them, because they're dialysis, restricted diet, and only by the kitchen you will get some extra snack to go with your patient. Number 3, which is very important before you go sending your patient. I'm telling you the real word. When you're working with your patient, you must assess your patient, because they're going out. And what is the assessment physically? And what is in physical is very important. Your head-to-toe assessment means you won't take much time, but check their skin. Any breakdown, any skin problem, level of consciousness. Is your patient is alert? Is your patient is vital signs are stable? You must document in your nurse's note and assess. And number 4, you are giving written report to your dialysis center with their weight, with their vital sign, with their medication. Any changes in condition you will send along with the patient. Everyone is okay. Now what happened? You have patient who's ordered for restraint. Check the order before your patient is leaving. Why? If you don't apply the restraint and patient fell, what happened? Who will be responsible? Us. I'll give you an example. In my time, when I was the director, I had a lady who was going out for dialysis. And she had, remember, these patients are mostly a diabetic patient. And she had double amputee. What is the meaning, double amputee? Both legs were amputated. And she was very alert, and she would go for dialysis. And she was in wheelchair, and they pick her up in the morning time, and she come back about 4 hours. In last few days, she started falling in dialysis because she was getting confused. And so she has an order to apply the restraint when she's going out for dialysis. And this is a doctor's order. And patient refused. And she used to go mostly early morning. So who prepare her to go the night shift? So that transportation comes around 7 o'clock. Morning shift is coming, transportation there 6:30, 6:45, and she leaves the building. And she said, the nurse, I don't want the restraint. And the nurse didn't put the restraint. And she went, and the transportation company picked her up. And they were the driver was taking her for dialysis center, and he abruptly stopped the van when the red light came. What happened to this patient? She fell out of the wheelchair in the transportation, and she fell. And this guy who was driving her, he took her immediately to Kaiser. Kaiser was the closest facility. He took her, but she didn't have a Kaiser insurance. They took her, they did x-ray, and they found she had a fracture. They called, it was Christmas Eve, I remember very clearly. And they called me, they said, what do we do? I said, I think you should. They brought her back to our facility. I advised her because she needed dialysis. They did not give dialysis, so I said, call her doctor and send her to St. B, that's San Bernardino Community Hospital, because she belongs that hospital with her insurance and her doctor. So we sent her out to the hospital. There she goes, and they did dialysis, and they reviewed the x-ray, and she was going for surgery. After surgery, the patient died. Now, we had a big lawsuits on that. Why? Because of her fracture. And what was the problem here is our documentation. But if you are a good nurse, you document everything, you're going to see correctly. And I had this case going on for longer time because it was going on in the court every time. And my fight was with, my nurses did everything, was the transportation company, because they should have secured the wheelchair. And they did not secure the wheelchair. But what do I have to prove in the court? Is number one, doctor has order for restraint. Was she a competent patient or not? So remember, when I did in foundation, and I said, in your exam, they're going to ask, whenever you're getting a restraint order, remember, patient has to be competent. So I have to prove this patient was competent. Where do I have to prove this patient is competent? In the nurses' notes and the doctors who will certify for your patient who is competent or not competent is physician. Your documentation might say alert. One nurse said confused, another nurse said alert. We are no one to say alert. Yes, we can document, but what do I have to prove? I have to talk to the doctor. I reviewed the chart very clearly, and I said, I am prepared because my nurses have done everything because they had the restraint on the patient. Patient is alert, but what was the problem is the transportation company, and they did not restrain. Now what happened? And it was good. The nurses document in the nurses note. So remember, I said assessment and documentation. CNA wrote in her charting, patient refused to apply the restraint. And the LVN documented patient left at what time, patient was alert, and patient refused to have a restraint. See how closely we can be in a problem. Your documentation, understanding is very important. Patient is going for dialysis. Your job is definitely to give report. Make sure you're sending your patient correctly, because what can happen as soon as your patient leaves out of the door, something happens to the patient. Who is legally responsible? Us, because that is your patient. Patient went out. I had 3 times some patient who fell in dialysis center. Immediately, I want to assess why these patients are falling in dialysis. And what was the reason? Nurses are not holding antihypertensive medication. So what happened? Patient feels dizzy, the medication is walked off, and patient are not getting another dose. You got to remember, you have a daily order, 9 o'clock, your antihypertensive, but you are the one who are giving medication. And you know your patient is going for dialysis, and you still keep on giving 9 o'clock when patient is going out for dialysis. Doctors are not going to call you and tell you, you hold this medication and change the order at 8 o'clock. It is us. We have to see that you are holding your medication. And ask the doctor and put it down. Hold medication on dialysis center. Now what happened? I'll tell you. Nurses never even look sometime, and they keep on. This medication is not in the card, and you're signing here every day, and you're signing here, and you are not even giving that medication. So what happened? Automatically, you're not even seeing this patient is going on dialysis. So what do we have to do here? You put on days, Monday, Wednesday, Friday, put the word hold. Put the word hold, so people will not sign. Are we clear? See how legality comes in our documentation very much. And so remember, patient is going for dialysis. Here you have 2 lines. I'll tell you, when we are working, we have much more responsibility. We are dealing with patients who are very confused, disorientated, they're weak, there are multiple problems. So you got to follow through. You're giving dialysis center your report. How? I have made a special form for the nurses. When they send the patient on dialysis, you must have these things documented. And anybody asks you a question, what do you do when you send your patient on dialysis? Number 1, you give report to dialysis. You assess your patient, and you document what time your patient was leaving, what time your patient is coming back, and give them some food, because they're not going to give any food to your patient. So remember that, and monitor for bleeding and monitor for blood pressure. So hemodialysis, remember a few things what I said to highlighted are semi-permeable membrane, diffusion word, and slightly temperature can be high. Hold the medication, check the blood pressure for your patient, and check the weight before and after. It's very important you check the patient's blood pressure, because they are what is orthostatic hypotension, because they lost a lot of fluid. Next is underneath is shunt or fistula word, and cross out the word is after end and leave the word graft. So if patient has fistula and graft, after end cross out the word, it says stereovenous, you can cross out, is fistula and graft. When patient has fistula, number 1, we all know, no blood pressure, no IV, no blood drawn on that arm. Number 2, exercise is good. If they have new fistula, and what do you give them? Ball squeezing. What do you monitor? Underline the word thrill and bruit. What is thrill? You palpate. What is bruit? You auscultate. So remember, number 3, pulse, check the pulse. Why? Because last word, ischemia. If pulse is not good, circulation is not good. Number 5, check the temperature. Number 6, any clotting and tingling problem, and you are not able to feel the bruit and pulse, you can notify immediately. So that covers, and now I will go, very important, are your complications of hemodialysis. I want you to remember is the now patient is in dialysis, and what are the complications during dialysis or due to dialysis patient has? Number 1, air embolism. Now those who were here, and I did in the Spider-Man package, the first thing was air embolism. And what did I said? Air embolism comes maybe with your patient with IV for dialysis patient, hemodialysis, maybe you have TPN patient, maybe you're giving IV. So air goes into the blood vessel. And what does the patient will go here? I want you to add the word pulmonary embolism. So what are we preventing here, patient? Going into pulmonary embolism. So what is the first problem here is air embolism. Now they will ask you, what do you do when your patient has air embolism? You will see cyanosis is okay, oxygen saturation, breathing problem because they are having a problem with the oxygenation. Changing sensorium means level of consciousness. I want you to write down there, what would you do if patient has air embolism? Number one, stop the dialysis, first thing, and give oxygen. And third thing I want you to add there, turn the patient on the left side and lower the head of the bed. So I want you to add there, under air embolism, stop the dialysis, give oxygen, and what do you do? Turn the patient to the left side and lower the head of the bed. What do you do in your question if patient has air embolism? Your answer is turn the patient on the left side and lower the head of the bed, preventing your patient going into pulmonary embolism. Are we clear? So what is one complication of hemodialysis is air embolism. And what is air embolism is leading into pulmonary embolism. What do you do when patient has air embolism? Yes, you will stop the dialysis, but turn the patient to the left side and lower the head of the bed. We have in a Spider-Man package, the first thing when I started, that is number one on air embolism. And where do you see air embolism? One of your complication for your patient with dialysis, hemodialysis. Number two, disequilibrium syndrome. And I want you to write down there is water intoxication. Water intoxication, or they use the word disequilibrium. Now when they're saying disequilibrium, what are you going to monitor here? Water intoxication. You are giving fluid, and underline the word, when you have water intoxication, there is a edema, cerebral edema. Too much of fluid, your body is not absorbing. Everyone is okay? Write down the word water intoxication, highlight the word cerebral edema. Too much of fluid leading into what? Cerebral edema. Second line, what do you monitor patient when they have cerebral edema? Hypertension, they're going in ICP, and they will have seizure, underline that, headache, hypertension. What happens when you have ICP? So what is water intoxication and disequilibrium is? ICP. What is the vital sign in ICP is the blood pressure goes up, pulse is low, respiration is low. What do you monitor patient here? Seizure. Now you will underline stop dialysis, reduce environment stimulation. Why? To prevent seizure. What do you do to lower the fluid? You can give hypertonic solution or mannitol. Mannitol is the drug you are giving to reduce cerebral edema. You can give IV. And mannitol is also given for glaucoma patient. So everyone should know what is the one of the drug for ICP is your mannitol. Okay? And hypertonic solution you are giving to reduce edema. And that also can be given. And what is mannitol is, another word for mannitol is osmotrol diuretics. You can add the word diuretics because sometimes they ask in the exam what is mannitol is osmotic diuretics. Everyone is okay? So what is second complication is they may not give word water intoxication, but remember the word disequilibrium. What is disequilibrium? Your level of consciousness. And that means because of the fluid, the voiding, your equilibrium, your balance of your body is not there. That's the voiding. Are we clear? Number three is encephalopathy. Third complication, why? Underline the word, they have toxicity of aluminum. Why? Because of antacid. A lot of people, they take antacid containing aluminum. Why? To lower the phosphate level. And also your fluid. from solution. Dialysing water has a lot of aluminum. So when you're giving dialysis and patients are taking aluminum antacids, it can lead to toxicity, and the fluid they're using is also high in aluminum. So what is third word is encephalopathy. What is encephalopathy is level of consciousness again, but too much of toxicity of aluminum. Data collection. Neurological assessment. What are we checking here? Neurological assessment, and also mental cloudiness, means confusion. And what do you prevent them from? Seizure. Intervention is notify, and I want you to highlight the word before seizure, bone pain. So remember, what is earliest sign of aluminum toxicity is the bone pain. If you're going to do Saunders question, it might come up, patient is going on hemodialysis, patient is having bone pain. What are you looking for? Aluminum toxicity. Are we clear? So one of the toxicity and that lead to encephalopathy, early sign is bone pain. And what do you do if patient has? Number one, stop giving aluminum containing antacid and notify the physician. That means patient has, and whenever you have toxicity and they use the word to remove, the drug is called chelation therapy. You can add the word chelation therapy. And chelation therapy means is they use the drugs to lower the aluminum toxicity. So the word is chelation therapy. That means there is chemical toxicity and you're lowering the toxicity. Next is, I will move on. So everyone is okay? Hemodialysis, and I said 3 complications. Everyone should remember what are the 3 complications are. Number 1, air embolism. Number 2, disequilibrium syndrome, which is called water intoxication. And third one is called encephalopathy, which comes from aluminum toxicity. What is the earliest sign of aluminum toxicity is the bone pain. And now I will move on, peritoneal dialysis. What is peritoneum? Means the patient can be walking around, laying down, they can do it, and standing, and they can do it their own, and they're injected in the peritoneum. Underline the word principle. Osmosis, underline that word. And peritoneal membrane. And large part solution fluid is moving via osmosis. So what is that? Is the fluid is moving via osmosis. Underline, what is osmosis? Higher concentration fluid, not the particles, from higher to lower concentration. And where are you giving peritoneal dialysis? In the peritoneum, in the abdominal area. Next is contraindicated, means you cannot give peritoneal dialysis if your patient has peritonitis, infection. If they already had peritonitis, you cannot use to give this patient peritoneal dialysis. Next is surgery, renal transplant, or any abdominal incision, any problem in the abdomen area. You cannot select to patient to have peritoneal dialysis. They're just checking if you really know what is peritoneal dialysis. Where are we giving here? Any problem here? Number 1, if patient has infection, you cannot use that site. Next is peritoneal dialysis catheter. Where is it? Underline the word 3 to 5 centimeter below the umbilicus area. So here in the abdomen, below the umbilicus area. So they put the catheter here. So hemodialysis, you have shunt, you have the peritoneal dialysis, abdominal area, this is umbilicus. Below this area, they put the catheter. So that means you're giving in the peritoneum, and you cannot give if somebody already had infection. Everyone is okay? Which is the contraindicated patient is here? Peritonitis. Now I want you to write down, highlight the word is solution, is a sterile. The other solution, I said safe water supply. But this solution must be sterile. Why? Because it can lead to infection. What do you have in the solution? Underline the word electrolytes and glucose. Very important that peritoneal dialysis is having what? Glucose. So what are you going to monitor when your patient is taking peritoneal dialysis? Hyperglycemia, because it has sugar in the solution. Next is, so everyone is okay, you cannot give peritoneal dialysis if patient has peritonitis. What kind of solution are we using? A sterile. Where are we giving this dialysis? Below the umbilicus area. Now we have 3 procedures in peritoneal dialysis. The first is called fill time. Fill means you're filling the fluid. Fill time, underline, and under it says by gravity. How do you fill? So you are giving fluid. How do you give the fluid? By gravity. It doesn't matter how long do you take. So how do you give fluid? So patient is using gravity and fluid is filling. Filling means you're giving the dialysis fluid. How long do you take it? There's no doctor's order. You can take 15 minutes, 1 liter. You're giving maybe in 20 minutes. But 2 words, by gravity. When you finish filling, then what do you do after the fluid is gone? Write down the word clamp it. They got to clamp. Why? Because you want to leave the fluid in the peritoneal area. Second one is called dwell time. What is dwell time is you clamp it, fluid is staying. How long your fluid is staying is your dwell time. Underline second line, how amount of time remain in the peritoneal cavity. Who is ordered that time? Physician. Can be 20 minutes, can be 8 hours. Then you do, so you keep it for how long? Who orders dwell time? Who orders dwell time? Physician. And if you don't follow, I will talk about that. And number 3 is drain. Now we are draining. And what do you do for drain? Remember, unclamp. Another word, unclamp. And fluid is again going down by gravity. So highlight the word outflow by gravity and let the fluid drain. Let me go back here again. Peritoneal dialysis lead to complication peritonitis. You cannot give dialysis if patient already had infection. What is the fluid contains here? Sugar and electrolytes. Are we clear? And what are the 3 process in peritoneal dialysis? Fill time. How do you fill the fluid? By gravity. After the fluid is gone, what do? We clamp it. How long you leave the fluid depends on your doctors. You don't have to follow doctor's order. You can fill it in. But which is important is your dwell time. Everyone knows what is dwell time means is how long the fluid is going to stay. And what do you monitor here is the doctor's time. Now, if you don't follow, what will happen? The sugar will go very high because it's very high in sugar. Drain time, unclamp and gravity. Again, by unclamp and gravity. Before dialysis, what do you check? Again, underline the word weight. And for here, you can also check the sugar. Because why? It causes their sugar to go up. So what do you monitor? Their blood glucose and weight before you give the dialysis. Then I want you to underline, do not allow dwell time more than doctor's order. So that's important. If you will not follow, what will happen? The sugar is going to be very high and it will lead to hyperglycemia. Turn the patient to increase the flow if it is not draining. Now these are the questions can be asked in your exam. Patient is at home and patient is calling you and patient says the fluid is not draining enough. So to help the fluid to drain, what do you tell the patient? Turn frequently. So if they're turning from side to side, it helps them to drain the fluid. Monitor the color and the clarity. What do you monitor? Monitor the outflow. Now let me finish. Complication are abdominal pain. Patient who's going for dialysis has abdominal pain. What do you teach patient for pain? Is normal. Underline the word inflow commonly cause pain. Few exchange, meaning is normal. For some time patient would feel pain. Number 2 line, disappear after 1 to 2 weeks. You are telling a patient your pain will disappear, but if not, then what can they use? Line 3, warm the solution. Underline the word warming pad or heating pad can be used. So number 1 question, patient is asking you. Remember, we are nurses. Your questions are going to be teaching and patient is asking you. I'm doing dialysis, but I'm having a lot of pain. What can I do? Your answer would be, it's normal for few weeks, but what can you do? Warm the solution. Because if you're doing a cold solution, that can cause a lot of abdominal pain. So you can go for abdominal pad, heating pad, or warming pad. Number 2, insufficient outflow. Now patient is asking you, the fluid is not returning out. After I am draining the fluid, then what do you tell them? Number 1, full colon. If they are constipated, it can cause slow drainage. So what do you increase? Fiber. Don't increase fluid because they are dialysis patient, but they can eat more fiber. Second line, keep the bag below the client's abdomen. Second line, third answer, check the kink. And next line, turn the patient from side to side. See how many answers you can give them. Patient is asking you, the fluid is not coming out. You give is fiber. Second line, you check the keep the bag below the level. Check the kink and check or milking of the tube. You can milking the tube and also turn the patient on side to side position. Number 3, check the flow of the fluid. In the first line at the end, abnormal outflow. If normal would be clear. So what should be the color of the fluid when they are doing peritoneal dialysis? Clear. So what is a normal color? Clear. Everyone highlight that word. Now your patient tells you in the second line, brown color. What is the brown color? Could be bowel perforation. Urine color may be bladder perforation. Very important line at the end is cloudy. Patient says, I'm doing my dialysis, but the color is cloudy. What is the meaning? Cloudy, sign of peritonitis. Everyone is okay? What is one of the complications of peritoneal dialysis? Peritonitis. What is the early sign of peritonitis? Your cloudy color of the urine. Number 4 is if you have peritonitis, what are the other signs of peritonitis? Are rebound tenderness, fever and pain, malaise, nausea and vomiting, cloudy color. What do you do when patient has sign of peritonitis? Do the culture, number 1. Number 2, you will give them antibiotic and sterile technique because the dressing need to be, if your dressing are moist, it will cause infection. So keep the dressing dry as much as possible and change the dressing. Everyone is okay? 3 things I want to remember. First thing is, where is the peritoneal dialysis? Below the umbilicus area. What do you monitor patient with peritoneal dialysis? Hyperglycemia. Their fluid has more sugar. And when you're giving dialysis, there are 3 things I said. Is your flow is first you are filling in, fill time. Which one is important to monitor? Dwell time. What is the dwell time? How long you're keeping the fluid in the peritoneum. And if you don't follow the doctor's order, sugar is going to be high. What do you monitor before dialysis are your blood sugar, monitor the weight, and how do you know your dialysis are functioning? Patient will lose weight and your electrolytes will go down, because that is the purpose of giving. What is the sign of infection is cloudy fluid. When you have cloudy fluid, meaning is sign of peritonitis. Let's take a break, then we'll finish the next part, okay?